The president of the Ambulance Paramedics of BC says an incredible number of the group's members are off the job or in treatment. This because of psychological injuries due to the pandemic and the opioid crisis. But the situation is not unique to BC. Paramedics across Canada are beginning to feel the mental and physical strain of current working conditions. A survey last fall in Ontario found 84% of paramedics reported an increased workload was affecting their mental and physical health. The heads of groups representing Canadian paramedics are calling for improved mental health services. This comes as staff shortages and unprecedented call volumes take a toll on workers. Well, with us to discuss the struggles currently being faced by Canada's paramedics is Mr. Deines, president of the Paramedic Association of Canada. Sir, welcome to Forum Daily.
Good afternoon. Thank you.
So can you briefly explain the current difficulties being faced by paramedics across the country, sir?
Yeah, well, first I'd like to start by thanking all the paramedics that are still showing up every day to provide the essential service to Canadians from coast to coast to coast. A very resilient group, and we'll continue to do that through this pandemic. But as you have mentioned, obviously, we are feeling the stress, just like a lot of other people, with the increased call volume, the increased pressures around responding to COVID, and some of the associated fallout from that for sure.
All right, sir. Well, what kinds of mental health services are currently available for paramedics in Canada?
Yeah, it really depends on the jurisdiction that you're in. Obviously, health is a provincial issue, and then depending on the jurisdiction in Canada, it depends on how paramedic services are delivered. So, for example, several provinces are provincially run services that have access to government and robust mental health and wellness programs, where there are other parts in Canada that have very small, either private operators or county or municipal-based services that may not have the same level. So it varies greatly from coast to coast to coast.
All right, Mr. Deines. Well, we mentioned that advocates are calling for improved mental health services across the country. What would that look like?
Sure, absolutely. I mean, the issues are very complex. Certainly in some jurisdictions, the addition of presumptive legislation in some jurisdictions would allow paramedics access to more supports, obviously funding for mental health and wellness and psychological safety clinicians and rapid access to them. Even in jurisdictions that have some of those supports, the wait times are growing, and that keeps paramedics obviously off the job. We want them to be healthy, of course, to do the vital work they do. And so on the mental health and wellness piece, those are certainly some of the things that can help, along with the workload side of things as well. And you know, we need more paramedics in the system for sure, as well as there's some jurisdictions that can do things to help mitigate the amount of calls that paramedics go to and where we take patients.
And considering the current service disruptions that we're seeing due to this mental health strain, what's at risk here in terms of paramedic services across the country if changes aren't made?
Yeah, absolutely. When we start decreasing the amount of paramedics that are in the system and able to work, obviously that has an impact on the amount of ambulance and paramedic crews that are available. And once we start talking about that, obviously response times will suffer and patients won't get a timely response to paramedics when they need them.
Just over a minute left here, sir, but just to give our viewers some perspective, how has the pandemic and opioid crisis impacted the work lives of paramedics?
Sure, it's made a tremendous impact. I was just on a national call the other day with the Public Health Agency of Canada. We know that the pandemic has increased the opioid toxicity death by 89% since the same period of time pre-pandemic. So the workload, just not only in pandemic COVID calls, but the opioid crisis, as well as some of the climate change emergencies we've seen in the country. And then, of course, just the day-to-day work. Responding to COVID patients requires paramedics and other public safety professionals to wear a different level of personal protection equipment that I'm sure you've seen in the news. That's very time-consuming and physically and emotionally draining on paramedics.
All right, sir, just a quick 30 seconds left here, but what do we know so far about how provinces and governments are trying to tackle this issue?
I think overall, there's been a good recognition that some things need to be put in place. Recognition, obviously, along with any issue, is the first step. So we've had some good traction around the country with providers recognizing that we need to provide some supports and do some better things to allow paramedics to respond to those in need.
We'll definitely have to keep our eyes out on these developments. Mr. Deines, thank you again for joining us today on Forum Daily.
Thank you very much for having me.